This video will cover 10 key signs you may have the flu and explain effective ways to treat it so you can recover quickly and prevent the virus from spreading to others. Influenza is a highly contagious respiratory illness caused by flu viruses. It affects millions of people every year and can lead to severe complications, especially in young children, the elderly, and those with weakened immune systems. Knowing the symptoms can help you catch it early, seek proper treatment, and avoid complications. What is influenza flu? Influenza, or the flu, is a viral infection primarily affecting the respiratory system, including the nose, throat, and lungs. Unlike the common cold, the flu often comes on suddenly and with more severe symptoms. Seasonal influenza spreads through respiratory droplets, which are released into the air when an infected person coughs, sneezes, or talks. Flu season typically peaks during the colder months, so being aware of its signs and treatments is especially important now. 10 signs you might have the flu. Let's explore the 10 main symptoms that could indicate you have influenza. 1. Sudden high fever. One of the most common symptoms of the flu is a sudden high fever, often above 100 degrees Fahrenheit 37.8 degrees Celsius. This fever can last several days and may come with chills. 2. Body and muscle aches. Body aches, especially in the back, arms, and legs, are a classic flu symptom. Unlike regular fatigue, these aches can feel intense and may limit mobility. 3. Fatigue and weakness. Fatigue from the flu is generally more severe than the tiredness experienced with a cold. You might feel exhausted and find it challenging to carry out daily activities. 4. Dry cough. A dry, persistent cough is common with the flu and can linger even after other symptoms subside. This cough might worsen at night, making it harder to sleep. 5. Sore throat. A sore or scratchy throat is often one of the early symptoms of influenza. It can be uncomfortable and painful, making it hard to swallow. 6. Headache. Influenza can cause a headache, often coupled with sinus pain or pressure. This can feel similar to a migraine and may be aggravated by light and noise. 7. Runny or stuffy nose. Although more common in colds, a runny or stuffy nose can also occur with the flu, particularly at the beginning of the infection. 8. Chills and shivering. Many people with the flu experience episodes of chills and shivering, usually occurring along with a high fever. This can cause discomfort and the need to layer up. 9. Loss of appetite. The flu can affect your appetite, making food less appealing. Nausea or stomach discomfort may also accompany this, especially in young children. 10. Chest discomfort. Some people may experience chest discomfort or tightness, particularly if they're coughing frequently. This can be a warning sign and should be monitored, especially in people with asthma or other respiratory conditions. How to treat the flu. There's no cure for influenza, but various treatments and self-care practices can help alleviate symptoms and speed up recovery. Here's how you can treat the flu effectively. 1. Get plenty of rest. Rest is essential for recovery. Your body needs time to fight off the virus, so prioritize sleep and avoid strenuous activities to conserve energy. 2. Stay hydrated. Drink plenty of fluids like water, herbal tea, and broth-based soups. Staying hydrated can help thin mucus and reduce fever-related dehydration. 3. Over-the-counter medications. Use fever reducers and pain relievers, such as acetaminophen, Tylenol, or ibuprofen Advil, to manage symptoms like fever, aches, and headaches. Avoid giving aspirin to children, as it can lead to Reye's syndrome. 4. Antiviral medications. In some cases, a doctor may prescribe antiviral drugs like oseltamivir, Tamiflu, or zanamivir Relenza. If the flu is diagnosed early, typically within the first 48 hours of symptoms, antivirals can shorten the duration and severity of symptoms. 5. Use a humidifier. A humidifier can add moisture to the air, easing nasal congestion, sore throat, and cough. This can make breathing easier, especially during the night. Point 6. Gargle with salt water. Gargling with warm salt water can help relieve a sore throat and reduce throat inflammation. Try this a few times a day for relief. Point 7. Avoid smoking and alcohol. Smoking and alcohol can weaken your immune system, making it harder for your body to recover. They can also aggravate respiratory symptoms, so it's best to avoid them while you're ill. Point 8. Eat nutrient-dense foods. A well-balanced diet rich in vitamins and minerals can support your immune system. Opt for soups, fresh fruits, and vegetables to help your body recover more efficiently. Point 9. Isolate to prevent spread. Stay away from others, especially the elderly, children, or anyone with a weakened immune system, as the flu is highly contagious. Isolating can prevent the spread of the virus to others. Point 10. Seek medical attention if symptoms worsen. While most flu cases resolve with rest and home treatment, severe symptoms like difficulty breathing, chest pain, or persistent high fever should be addressed by a healthcare provider. Pneumonia and other complications can arise, so it's essential to monitor symptoms closely. How to prevent influenza. The flu vaccine is the best way to protect yourself and reduce the severity of symptoms if you do catch the flu. It's recommended for everyone over 6 months old, particularly those at higher risk for complications. Other preventive measures include washing your hands frequently, avoiding close contact with sick individuals, and disinfecting commonly touched surfaces in your home. Remember, early detection and treatment are vital. If you start to notice flu symptoms, take action quickly to manage symptoms and prevent further complications. Thank you for watching. We hope this video has provided you with valuable information about recognizing and treating influenza. Please like, subscribe, and turn on notifications for more health tips and updates. Stay healthy and take care of yourself and your loved ones, especially during flu season.